Hi everyone, I'm Nicole Schoenborn and I am the Southwest PTTC Evaluator, and I'm going to walk you through our needs assessment results for 2023. Just like to acknowledge that this work is paid for through a SAMHSA grant, but these views don't necessarily reflect the views of SAMHSA. If you have questions or need copies of anything or today's presentation, you can contact us at pttc6@ou.edu. So our respondents from our 2023 needs assessment included 154 people, and the survey was distributed between June 15th and July 28th of 2023. We sent this survey out via our constant contact subscriber list for the Southwest PTTC, and a couple reminders were sent out as well to increase our response rate. We had 73 participants that were outside Region 6 that responded to our survey. So we actually had 81 that were in our region that responded to the survey, and you'll see those represented in the map, and the darkest areas indicate the greatest number of respondents. So most Region 6 respondents were from Texas at 30%, followed by New Mexico at 23%, Oklahoma at 20%, Arkansas at 17%, and Louisiana at 9%. And again, we had a total of 81 respondents that will be included in our data set for today that were in our region of service. 39% of the respondents serve rural or frontier communities. We also had 37% that served metropolitan or suburban communities, and 15% that served tribal communities. We also had another 9% that included other responses or had unknown areas of service. About the respondents, so we had 37% that were certified as prevention specialists that responded to the survey. 39% indicated they were currently in progress with getting certified. We had a wide range of experience, including 0 to 40 years in prevention, but the 10 years in prevention was the average. Our participants also had 75% or higher had a bachelor's degree. So that is our participant sort of backdrop, just so you can have an idea as we move forward with talking about the needs. This chart shows our top 3 training and technical assistance needs by category, and the instrument that we used was an instrument developed by the PTTC network, and we adapted it to include a few items around ACEs and trauma, since that is our focus area. So that's where these items come from. In terms of the needs, we have the broad areas across the top. So we have onboarding, assessment, capacity, planning and evaluation, implementation, and data-related needs. And then you can see the top 3 needs below each of those categories. So for onboarding, for example, you can see 84% said they had training or technical assistance needs in cultural competence, cultural humility, and cultural responsiveness and prevention. 79% said racial equity and inclusion services. 77% said training around the strategic prevention framework. And this is all under the category of onboarding the prevention specialist. So some of those basic training needs that we provide. And under assessment, 81% indicated they'd like training around prevention and social determinants of health. 79% on identifying and addressing health disparities to improve health equity, and 78% around identifying risk and protective factors that impact disparate populations. For capacity building, 83% said building community understanding about the impact of trauma on the developing brain. 79% identifying and engaging diverse stakeholders or non-traditional partners. And also 79% at mobilization and engagement of community stakeholders. Under planning and evaluation, 81% indicated they needed TTA on evaluating prevention programs, policies, and practices. Also, 81% said designing prevention interventions that build resilience as an outcome, and 80% on sustainability planning. For implementation, 82% needed training or TA on adapting prevention programming to be more trauma-informed. 77% stated strategies to reduce substance use disorder stigma, and 77% stated training around engagement of priority populations in prevention programs, policies, and practices. And lastly, our data column, and this pertains to data literacy needs. 72% stated they needed training on data visualization strategies, 68% data collection strategies, and 67% on interpreting data. Now we'll get into our qualitative data themes. And so for these responses, participants responded to open-ended questions on other related training or technical assistance needs that they had. So those items that wouldn't have been included in the slide beforehand, so not in the quantitative section. So our first theme with those responses was around coalition training. So some specific things that were mentioned, including balancing the dynamics of coalitions and funders, coalition engagement, promoting sustainability in coalition work, and evaluating coalition activities. For intersecting systems, substance use disorder and suicide, the intersection of substance misuse and mental health, and training around systems thinking and prevention. Our next topic, onboarding the prevention specialist. Some training around Prevention 101 for new hires, how to be a mentor, program coordination and management, which included funding, reporting, budgets, grant writing for the prevention professional, certification exam prep, facilitation, and group management. And our last theme included things around effective strategies, policy change in tribal communities, substance misuse prevention school strategies that aligned with the multi-tiered system of supports, or MTSS, and effective use of media for prevention messaging. So that concludes our short overview of our 2023 needs assessment results. I want to offer you my contact information in case you need further information or have questions. It's NicoleD@ou.edu. I also encourage you, as always, to contact and interact with us via the website, our mailing list, and take a look at all those great products and resources that we have at the Southwest PTTC. I hope you have a great day, and I want to thank you for your participation in our needs assessment and all the work that you do every day to improve our communities. Have a great day.